We're good. Morning, everybody. Welcome to, what's the date today? 26th?
26.
May 26th, Coronavirus Task Force meeting. We were doing these twice a week during the entire. Yeah, could you guys keep your microphones muted so that unless you're talking, obviously. This is the Coronavirus Task Force meeting for May 26th. We were doing this meeting twice a week for the entire pandemic. We went last week once a week. We're doing it on Mondays, but today is Tuesday. But we're still doing it once a week. We're doing it on Mondays until further notice. I want to remind everybody that we have Brittany helping us this morning for the hearing impaired in our city. I want to thank her and remind everybody to please talk slowly and clearly so that she can keep up with us. And I want, before we go to Karen, and Dr. Frank is having trouble getting on. He's trying to get on, but I'm going to go to Karen first today because she was on. Give me 2 seconds, Karen. I want to remind everybody where we are currently. All right. Contrary to popular belief, Lake County is still in phase 2. So, meaning we're 1 week delayed from everybody in phase 2. Hold on. I want to share this so that people can see it. So, Porter County, LaPorte County, every county in Indiana except for Lake County, Cass County, and Marion County are in phase 3. We are in phase 2 still. So what is stage 2 technically? What is stage 2? City Hall is open by appointment only. Phil, is that still the case realistically?
Um,
Why don't you step forward?
Yep, sure.
This is about City Hall.
We set it up where we're asking everybody to schedule appointments so that we didn't have a group of people all coming in at the same time and causing where we couldn't have social distancing from each other. So far, based on how many people have come to City Hall, we have not had that issue whatsoever. It's been very spread out, and we don't have everybody trying to come in all at once. So what we're doing is if you come in and you have not made an appointment, we will still try and help you and get you to the right department and help you with your permit or license or whatever it may be. If we do have quite a few people all at once, we may ask you if you're willing to take our phone number, make an appointment, and come back at a different time so that we can still do the social distancing.
Okay. Are we doing temperature checks?
We are still doing temperature checks.
For everybody?
For everybody. We're protecting our employees as well as the residents that are coming in that need to get business done.
Okay, thanks, Phil.
You're welcome.
So City Hall is open. This is actually our 3rd week being open. We opened City Hall as soon as it was legal to do so. We don't like not working. You know, we work for the taxpayers and we don't sit at home. So anyway, so that's stage 2 still. I mean, City Hall's open by appointment only, as Phil indicated. Gathering limits are 25 maximum right now. 25 people maximum. Social distancing must be maintained. Non-essential travel is allowed in stage 2. So you could travel for pleasure, so to speak. Go on a hike, stuff like that. Religious services are allowed. I went to church in Gary yesterday. There wasn't a lot of people there. I say 30 people max, 25 people technically max in Gary. And it was a nice service. Everybody was wearing masks the whole time. Just like if you come to City Hall, you should be wearing a mask. So religious services are allowed. In fact, Rick, could you go ahead and unmute Rick Sparks? Rick's from Hammond's First Baptist Church. I know you guys are this is about your 3rd week, if I remember correctly, Rick, of practicing services on the weekend. Is that true?
That is correct. We've had services the last 3 weeks in the auditorium. So this holiday weekend, a lot of people, there were people out of town, but it was we did it social distancing. We're just meeting on Sunday mornings. This next week, we're going to start back on Sunday nights. So,
what percentage-wise, what do you think the crowd is compared to your normal crowd right now?
I'm saying maybe 40%. A lot of the elderly are staying at home, obviously. We're not running any of our buses. We don't see that in the near future because of just the problem of putting a lot of people in a bus. So I'm saying 40%, and I don't really, that's just a guess.
I know at the service I was just in Gary, I went to Mount Moriah in Gary with Pastor Johnson, who's a great guy. But I know one of the things that was not normal was there was no choir. There was not a lot of music, as I'm used to when I go to churches. Is that the same with the First Baptist Church right now? We're cutting down on the music and focusing more on the gospel?
Our choir and our orchestra are not meeting yet either. Of course, we have our pianist and our organist playing. We have a couple specials, but we do we rebroadcast previous specials from earlier. So that's how we're dealing with some of the music needs.
Okay. Yeah. Okay. Well, I appreciate it, Rick. Thank you very much for chiming in. So religious service are allowed, and still in Lake County, I guess it's non-essential retailers, places like liquor stores, clothing stores, furniture stores, jewelry stores are only 50% capacity limits currently. So that's stage 2. Also, restaurants, barber shops, salons, tattoo parlors are open at 50% capacity as well. I just went to breakfast this morning at the Wheel, first time in a couple months. It was very nice, but every other table is taped off. Nobody sitting at the bar. All the servers are wearing masks. All the waiters and waitresses are wearing masks. So if you haven't been out to a restaurant, that's what it looks like now. So in Lake County, what is still closed? Because we're still in stage 2. Bars and nightclubs, still closed. Gyms and community centers, like the Sportsplex, the Shepherd Center, the YMCA, still closed. Playgrounds, tennis courts, basketball courts, water parks, still closed. Casino, still closed. Movie theaters, still closed. Schools and universities, still closed. That's currently Lake County, where we are in stage 2. Now in stage 3, if you're listening from Porter County or LaPorte County, in stage 3, this is a good question. Thank you. Appreciate it. My Assistant Chief of Police, Andy Short. What is open in stage 3? Gyms and fitness centers are open in stage 3. So YMCA and Portage is probably open. And retail stores and malls could open to 75% capacity. So this is coming next week for us in Lake County. Playgrounds, tennis courts, basketball courts, etc. are open in stage 3. So if you want to play tennis outdoors, go to Porter County. It's open, I think. Community pools can open. I'll be honest, I talked to most mayors, and I haven't heard one mayor that plans on opening any community pool in this summer. In fact, I think most of them have already announced no community pools will be open all summer, even though it's allowed in stage 3. Campgrounds may be open in stage 3, so like the dunes. Movie theaters can open at 50% capacity in stage 3. So basically in stage 3, what remains closed? Bars and nightclubs, sports venues, museums, things like that, and K through 12 facilities, still closed in stage 3. So right now in Lake County, thank you, Andy, we're going to stage 3 on Monday, June 1st. And we will update you again on Monday, June 1st on what is new for us in Lake County, but in Porter County and LaPorte, they're already in stage 3. All right. I'll do a quick report real quick, and I'm going to pass off to Dr. Frank to give us our report. And then we'll move over to Karen Callahan over at Franciscan Healthcare Center Hammond. I'd like to remind everybody that we last met on Monday, May 18th, and there was 490 positive cases in Hammond. that has gone up 99 people. We have basically 100 new infections in Hammond since we last spoke. We have 579 positive cases in Hammond, Indiana. 16 fatalities in Hammond, Indiana since the beginning of this disease. In Indiana, there are almost 32,000 Hoosiers that have tested positive for COVID-19. 1,832 fatalities in Indiana since the beginning of this disease. I know everybody's starting to get back to work. I know everybody's excited to get outside into the beautiful weather. I know people are happy to be able to go to restaurants now, but protect yourself. It's still out there. That's all I have to say. So now I want to go to Dr. Frank Rossana from Comprehensive Care, who appears to have solved the password dilemma. How you doing, Dr. Frank?
I'm doing all right, thank you. How are you?
Good. Thanks for coming back.
Sorry for the delay.
No problem.
I guess long of a weekend. My brain's not back yet. I don't have a whole lot new to report. I think that the biggest talk now is what you were just covering is we're kind of moving into a different stage, and that is the reopening stage. So it's going to be more of what's open, what's not open, going forward, and that obviously is varied significantly depending on where you live in the country. As far as the virus itself goes, the country as a whole is doing very, very well. We have absolutely succeeded in flattening the curve. There's, nowhere in the country did we overwhelm the healthcare system. The closest we came to that was New York City, but that didn't happen, fortunately. So, all things are looking quite good. Hopefully it'll continue to be the case. I expect we're going to see some flare-ups as things start opening, but I think we've learned enough that we can control those a little bit more effectively than we did at the beginning. We understand how this virus travels and what the risk factors are, and we can do a better job of protecting those people that are at risk and hopefully minimizing the effects going forward. So to me, it's still there, like you said. We still need to do the same things. I was at the garden store yesterday wearing a mask outside in the heat, looking for some flowers to sprucing some things up, and it was not comfortable, I can tell you. But everybody was wearing them, and I think that's what's important. And if we do that, I think we're going to do well.
So do you wear your mask if you're exercising, Dr. Frank?
No, I do not. I can't. It's too much, too restrictive. And honestly, I don't think that there's a significant need unless you're running in a mass marathon and there's people all around you, which I wouldn't recommend doing. But if you're out by yourself and you can socially distance, your risk is going to be very low.
Okay. Now, another thing I read recently was in South America, where the weather is getting cold now, that we're switching seasons. They've seen a recent flare up in South America of new reported cases. Is there something to be said about, because the warm weather's coming, you might see the cases go away until September when it starts turning cold again and when we should be more on guard?
It's possible. I don't think we know the answer to that question. I know there's debate, the southern states are doing quite well. There's debate as to whether that's got to do with the weather or the way they've managed it. And I think the jury's out on that one, truthfully. I wouldn't be surprised if it's a little combination of both. So it's entirely possible. I think by the time that happens, we're going to have far better treatment options. We may even have a vaccine. I keep hearing another company that have successfully passed into phase 1 into phase 2 trials. So the likelihood that we're going to have vaccine available in the fall, to me, is looking more and more prevalent. So I think that's a good possibility.
Okay. Thank you very much, Doctor. Great to talk to you. All right, we're going to go to Karen Callahan at Franciscan Health Center Hammond. And Karen's also, just like Dr. Frank, she's been on every call with us from the very beginning. So I want to thank Karen very much. Thank you very much. And why don't you go ahead and give us your report for the week, Karen?
So the hospital's in good shape. We're kind of still in a plateau, still seeing COVID patients, still discharging patients with COVID. On Friday of last week, because I don't have the report from yesterday because it was a holiday, we had 23 positives in the hospital, 13 rule out, 275 patients discharged home, 45 patients deceased, and the hospital is at about 110 capacity, but the ICU has 2 beds open, but their rooms are at 16, the amount of patients, and only 5 are positive COVID. So we are seeing patients starting to come back, being a little bit less scared to come to the hospital, which is a good thing, because if, Dr. Masana talked about that a couple meetings ago, the people that really need the care, like heart attacks and strokes, we still want them to come in if they, truly need an emergent situation. And that's really, I don't really have anything new. I think just continuing with this new normal. When you go outside now, if you see someone without a mask, it's almost like, where's their mask, So it's the new normal for sure. You feel naked if you don't have your mask on, because we are all wearing them. Mark had sent me an email that was I think it was an article in one of the newspapers related to, we know that the virus is spread person to person. That's a knowledge base for sure that we know. But initially they thought it was on those inanimate objects, like the fomites, like the door handles. And it looks like, as we're learning, it's a little bit less viable and virulent on those different door handles and different things, those surfaces that we touch. But I would still caution people, hand washing is the key to getting rid of any germs. So that vigorous hand washing for 20 seconds with soap and water is still huge to help keep this virus at bay. So that's about all I have.
Okay. Right now, is in the hospital, are you guys letting up your guard at all, or is it still pretty? Last time I was there, I wasn't even allowed to go in myself, and everybody, it looks like a lot different than a couple of years ago when I visited the hospital. Is it still
correct?
High alert kind of atmosphere?
Yes. And we have what we call a split flow in our triage. So everyone comes in and they are triaged on the outside, which is something we've never done in our whole life. And then they're decided if they go into like the COVID area, or they go into kind of like the clean area. But right now, and especially in the emergency department, everyone is COVID suspect until proven otherwise. So that will remain. The visitor restriction has not been lifted as of yet. And remember, it's for everyone's safety.
Okay, thank you, Karen.
You're welcome.
I'm getting a few questions over the internet about the parks and skateboard parks and things of that nature. So I'm going to go first to Mark Hines. So Mark could give us an update on how he views the world in the parks right now. And then I'm going to go to my assistant chief of police and ask him how he would react to a situation. So let's go first to Mark. Mark, what's the current status of your parks?
Hi, Mayor. Right now, the kind of the guidelines that the CDC has for us that we're currently in stage 2 is to visit your parks close to home. Prepare before you visit. Stay at least 6 feet away. Your social distancing, and the things not to do. Don't visit parks if you're sick. Don't visit them if they're crowded. Don't use playgrounds. Don't participate in organized sports and activities. So that really, what does that mean for us? Ultimately, we're still in that stage where you can go and use our greenways, our bike trails, our walking. So walking, running, jogging, riding a bike, walking a dog. I'm sorry, I know I always speak fast, so I need to slow down. That is something that we do want to remind everyone to do those things. We're preparing that, assuming the mayor opens us up or moves Lake County into stage 3 beginning June 1st, At that point, that's when some of those other facilities that you mentioned will start opening. That's when the courts, the basketball courts, the skate parks, the tennis courts, the soccer courts will start to open. An interesting side note that the governor announced in his last announcement last week was that he moved. Originally, playgrounds were going to open June 1st in that next stage. He's now made the playgrounds as a to be determined in his executive order that he put out last Thursday. So that's very interesting to see. And that's one of the reasons the article that I have forwarded on to Karen and Dr. Frank and the group for everyone's awareness that if the CDC is backing off of that, we'll see if where the governor takes us here in the next week moving forward.
Okay. All right, now next I'm going to go to Assistant Chief of Police, Andy Short. Andy, you know, what do the officers do when they drive by the skate park and they see kids in the skateboard park? I mean, like, we're happy that kids are recreating and they're not in the mischief, you know?
Right. We prefer that.
Right.
Yes, but what we're doing now is that we're still going by, we'll toot the siren, try to make them aware. But like some of the other parks that we do have out there, I've went to them as well as some of the other guys. We're noticing that we're getting a lot of people from Illinois that's over here, and they're thinking that all of Indiana is open. And so we pretty much given out different information saying, hey, not us, but you can go down to Porter County or some of the other areas. But it's tough. It's tough right now.
Yeah, I've seen it myself a number of times, and I feel like a mean guy, you know, stopping. And, you know, if I go by the skateboard park and there's one kid in there by himself, it's like he's social distancing. I mean, you know, it's a tough issue. And I know a lot of neighbors are calling complaints to the police department, and they get upset because the police department's not out there breaking up these gatherings. It's just a tough situation, you know, and obviously the police department has bigger issues to take care of than two kids that are skating in the skateboard park as well. So the good news is in 1 week, we're not going to have to worry about these things anymore because we will officially be in stage 3. Thank goodness. Does anybody else have any other reports? Anybody online? All right, I want to thank everybody for this week's coronavirus task force meeting. We don't have a lot of new information. At least next week we'll be in phase 3 and we'll have that to talk about. So I will see you guys all on Monday, June 1st at 10:30 for our next installment of the coronavirus task force meeting. I want to thank everybody for their participation, and I'll see you next Monday. Bye.